Hello, everyone. I hope you are very well. And today, my team and I will talk about the article Temporal Trends in Treatment and Subsequent Neoplasm Risk Among 5-year Survivors of Childhood Cancer into 1970 to 2015. Well, about the article, the researchers know the important association between cancer treatments and subsequent neoplasms in children who survived cancer. However, they realize that it is unknown whether temporary changes in therapy are associated with changes in the risk of subsequent neoplasms. So, the researchers wondered whether the treatment age-related changes in chemotherapy and or radiation doses are associated with changes in the risk of subsequent neoplasms over time among childhood cancer survivors? To answer this question, the researchers created a retrospective cohort study with a 5-year longitudinal follow-up of childhood cancer survivors diagnosed at participating institutions in the United States or Canada between 1970 and 1999. Participants who were under 21 years old at the time of initial cancer diagnosis were chosen. In addition, the participants completed a baseline and up to 4 follow-up questionnaires. The final follow-up date was 2015. Subsequent neoplasms were identified by a self-representation report or by close relatives or a death certificate and confirmed by a pathology report or a death certificate, medical records, or both. All the subsequent neoplasms that occurred 5 years or more after the initial cancer diagnosis were evaluated. Later, neoplasms were classified into three mutually exclusive groups: posterior malignant neoplasms, benign meningiomas, and non-melanoma skin cancers. Cancer therapies, including surgery, chemotherapy, and radiation, were determined by abstracting from medical records. And among childhood cancer survivors, the risk of subsequent malignancies neoplasms 15 years after initial cancer diagnosis continued to increase for those diagnosed in the 1999s, although the risk was lower compared to that diagnosed in the 1970s. This lower risk was associated with reduced therapeutic radiation dose.
Okay, now we are going to talk about the manipulated factors. We have four of them, and the first one is the only subsequent neoplasm that occurred 5 years after the initial cancer diagnosis were evaluated. The cancer therapies, those are surgery, chemotherapy, and radiation. The cumulative dose of alkylating agent was reported as an equivalent dose of cyclophosphamide. And the last one, the maximum radiation treatment dose for each patient was calculated for 8 body regions: brain, other head, neck, chest, abdomen, pelvis, arm, and leg.
Hi, we're going to talk about the non-manipulated factors of this study. The first one that we could identify was the race and ethnicity one. This was obtained through self-report that the children filled in their questionnaires, and they could select any of these races that appear here. It was used only for descriptive purposes, but we could find relevance in it. And the relevance is explained in this table. We can see that we circled the race and ethnicity factor here, and it is separated by the races. So we have white, non-Hispanic, black, non-Hispanic, Hispanic Latino, and other. And in these columns, we can see the overall cohort and the cohort by years, that is separated by years. But we're going to focus on the overall cohort and on the races. So as we can see, the white non-Hispanic people was the one that had most survivors of all the races, and then the black non-Hispanic, and at the end the Hispanic Latino race. So this can show us that race and ethnicity has an important influence on the study, because people of different races could have genetic factors that could predispose them to having these types of neoplasms or to not responding to the treatment. So that's why race and ethnicity should be considered as an important factor.
Well, the next non-manipulated factor is the sex of the patient. Beside this part, the differences between female and male, of course. This gains relevance when we start to talk about the different types of cancer, like, for example, the breast cancer. Just like the article said, the most common subsequent malignancies were breast and thyroid cancer, and thanks to this, we can understand that breast cancer is really important. And of course, after that, we can also take a look to the amount of survivors in the different decades. Here we can see the overall cohort with 23,000 survivors, and after that, in the 70s we have 6,000, in the 80s we have 9,000, and in the 90s we have almost 8,000. So we can see the difference of the amount of survivors in different decades, and I think this could have relevance in a different type of article.